Hello friends, welcome back to my channel Nourish Nectar. So today let's talk about measles. Measles is a common respiratory infectious disease which is seen in children. It is highly contagious disease. So here contagious is nothing but easily spreadable. That is, one person is infected, it can easily infect the other person. It is also called as acute infection because infection will be for some period. Then the person get recovered. After recovery, he will also develop with lifelong immunity in his body against this virus. It is also found that chances of getting infected again is very rare. It is also called as childhood illness because it is seen more in children, but it can also affect at any age group. Suppose if a person did not get infected in his childhood, he can get any time if he is not vaccinated because vaccine can prevent this measles virus. So most people do not get this virus disease more than once because lifelong immunity IgG will be present. That is, it will develop after the infection for once. So it affects 20 million people in a year, most seen in developing countries. So global vaccination, it has been reduced the number. So next, let's move on to the route of spread. Route of spread is through airborne disease. That is, airborne is nothing but which is spread through respiratory droplet. That is from cough or sneeze of infected person to the another person. That is, when they cough, respiratory droplets spread to the air, and in this respiratory droplet, virus will be present. So, this virus can remain in air for 2 hours. And when other person in contact with air inhale that air, he get infected easily. And also, it can spread through direct contact with mouth or nasal secretion of infected person. Talking about risk factor, vitamin A deficiency, unvaccinated people, immunodeficiency, pregnancy and contact with the infected person. So here vitamin A deficiency, that is if any child or person is having vitamin A deficiency, if that person is infected with measles, he can get complication that may lead to blindness. It also infect conjunctiva of eyes. Unvaccinated people, that is if person is not vaccinated, he will have less immunity, so chances of complication will be more. Immunodeficiency, that is here person will be having very less immunity. Example like HIV patient or the person who is an organotransplant, so with them the immunity will be very less and the virus can cause complication. And in case of pregnancy, when mother is infected, chances of fetus getting infected is very more, so child will be born with the infected. And last, that is contact with the infected person. So contact with infected person, so because as it is a contagious disease, it will be spreaded easily. Let's move on to the signs and symptoms. As we know, measles virus enter via respiratory mucosa or root or the conjunctiva. So once the measles virus get onto the mucosa of unsuspecting person, it quickly start to infect in the epithelial cells, that is in tracheae or bronchi. So measles virus uses a viral protein on its surface which is called as hemagglutinin or H protein, and also fusion protein, that is also called as F protein. Here H protein, that is hemagglutinin protein, bind to a target receptor in the host cell which could be CD46, which is expressed on all nucleated human cell, and also SLAM, which is found on human cells like B cells or T cells or antigen presenting cells. So here SLAM, that is stand for signaling lymphocyte activation molecule, or nectin, that is a cellular adhesion molecule. Once bound, the fusion or F protein help the virus to fuse with the membrane and ultimately to get inside the cell. Now the virus is single-stranded RNA virus and it is also called as negative sense. Means it is first has to be transcribed by RNA polymerase into positive sense mRNA strand. After that, it is ready to be translated into viral protein which is wrapped in the cell's lipid envelope and sent out of the cell as a newly made virus. So within days, measles virus spread to local tissue and is picked by the dendritic cells in alveolar macrophages and carried from the local tissue into lungs, and from lungs it get transferred to the local lymph node, and from there it spread and it get into the blood, and it will spread more to the lung tissue as well as other organ like intestine or a brain. Now it is typically take 10 to 14 days from the time that the virus enter the body to start the symptom. So this period 10 to 14 days is also called as incubation period. Once the symptoms start, it enters the prodromal period, which lasts around 3 days. So here it starts with high fever that is greater than 104 degree Fahrenheit with malaise and anorexia. Malaise is nothing but weakness or tightness. And also 3 C's is seen, that is cough, coryza and conjunctivitis. Coryza is nothing but in nose mucosal membrane get inflamed and it produces runny nose. It is also called as stuffy nose. And conjunctivitis is inflammation and redness of white part of the eyes. And 1 2 days later it comes the ananthum phase, that is where rashes on the mucous membrane that look like small white dot on the mucous membrane of the mouth, which is seen. So it is also called as Koplik spot. So this present opposite to the molar teeth. And next 4 days, that is exanthum phase, which is where red flat maculopapular rash is seen. It spread from the face to all part of the body, that is it spread to the extremities. And here first it will be red rashes and then later it will change its color to brown and later it will disappear. So that is it lasts for 4 days and leads to recovering phase, which lasts for 10 to 14 days with final symptoms, that is usually persistent cough. In general, infected people are most contagious starting from the final day of incubation period to the prodromal and exanthum phase. So here 4 days before a rash to 4 days after the onset of rash, it is a highly contagious period. The good thing is that once all this is over and recovered from measles, they have lifelong immunity. And let's talk about complication. Since measles affect various organs like lungs, intestine and brain, it leads to complications like pneumonia, diarrhea and inflammation of the brain. That is encephalitis, all of which leads to death. And also it causes otitis media, that is middle ear infection. So that is, in addition, measles can suppress the immune system for 6 weeks. So this can contribute to the bacterial super infection like otitis media and bacterial pneumonia. So all of these complication is very worst among young infant who typically have highest rate of mortality during the measles outbreak. Prevention is main vaccination, that is MMR vaccine of 2 doses. So here MMR means measles, mumps, rubella. So these MMR vaccine give protection against 3 virus along with varicella vaccine is also be given. So first dose, that is 12 month to 15 month. If traveling abroad, first dose can be given to infant at 6 month to 11 month. Second dose, that is 4 to 6 years, can also be given after 4 weeks after first dose. And second is human immunoglobulin, so can also be given because it give immunity against these virus. And the patient who is infected should be isolated and asked to wear face mask and hand washing. Treatment. So here treatment is nothing but supportive treatment to reduce the symptom. Antipyretics is given because in symptom we could see the fever. To reduce the fever, antipyretics is given. And in complication, pneumonia is seen. For that, antibiotics is given. And plenty of fluid to prevent dehydration. Vitamin A, that is to prevent its deficiency because it may lead to blindness. Thank you.